Hey. Well, welcome to our closing luncheon. We're going to get started with the proceedings. I want to thank everybody for sticking around for the last event of the conference. It's great to see so many people in place. How many were out last night at one of the events that we were sponsoring last night? I see hands going up. You look like you recovered. We've not had to bail anybody out of the Washington, D.C. Police Department, so we seem to be in good shape in that stead. So because of that, we'll go ahead and thank the sponsors of last night's event. The American Heart Association, the Southwest affiliate, American Water Resources, and Linebarger, Goggin, Blair, and Sampson, LLP. How about a round of applause for all of those sponsors of last night's event? And the wonderful band that played into the wee hours of the night. Thank you all. We honor your support for the Conference of Mayors. This morning, we presented our Dollar-Wise Awards, and one of the winners was Mayor Joe Kilsheimer of the city of Apopka, Florida, who has a program called Youth Works. He was unable to make the meeting this morning, but he is here now, and so it gives us the opportunity to rightfully honor him. He made a trip back to Washington just this morning, so come on up. I want to bring him up here. He can make some remarks, and please join me in congratulating the mayor of Apopka, Florida, Joe Kilsheimer. Joe. Get the award.
Thanks so much.
And we take a picture. Tom, you'll take a picture with Joe? I'll get on this side.
Turn around. Oh. All right, thank you.
All right. A few words.
All right. Thank you very much. I had a city council meeting last night, so I flew home yesterday and flew back this morning, and I know that Mayor Cornett stood in for me this morning. I want to just offer my thanks to the U.S. Conference of Mayors and to the Bank of America Charitable Foundation for this award. We're very proud of our Apopka Youth Works program. We started it just 3 years ago. We put it together actually in a matter of 8 weeks after we decided to move forward on it. The Apopka Youth Works program is a partnership with our local federally funded jobs and workforce agency called CareerSource Central Florida. We started off with 32 youth working with employers in the Central Florida or Apopka area. We expanded it last year to 75 young people. These are high school juniors and seniors who come from low and moderate income families, and this year we're going to expand that to 100 young people, so we've tripled the size of our summer employment program in just 3 years, and so we're very proud of that fact. And we also make sure that all of our kids get some form of soft skills training and financial literacy training as part of that. This award from the Dollar-Wise program is going to go to greatly expand that financial literacy training. So thank you very much to the U.S. Conference of Mayors. I very much appreciate this.
Thanks, Joe. Thank you. Thank you. All right, for the next part of our program, I'd like to call upon the mayor of Boston, Marty Walsh. He's the chair of our Substance Abuse Prevention and Recovery Task Force, and he's going to introduce our luncheon speaker. Mayor Walsh.
Thank you very much, Mayor. And I want to begin by thanking the Substance Abuse and Treatment Task Force. I want to thank Mayor Stephanie Rawlings-Blake, former Mayor Stephanie Rawlings-Blake, the former president of this association, for naming me the chair of this task force. And I want to thank the U.S. Conference of Mayors President, Mick Cornett, for continuing to champion this issue and to rise the profile of what we're talking about when it comes to addiction. I also want to thank the Vice Presidents, Mayor Landrieu, Mayor Benjamin, and Tom for your leadership here at the conference and what we do every single year. I have the great honor of introducing the Surgeon General, and I'm going to do that in a second. Dr. MURTHY has been a strong advocate for those folks struggling with addiction. He has pushed for a deeper national understanding of substance abuse, and he has paved the way to support Americans on the road to recovery in a more compassionate and more effective way. Admiral MURTHY put a study out, Facing Addiction in America, and it's a landmark report. He will go down in history as the first Surgeon General to issue a report on any substance abuse disorders. The report describes substance abuse as a national public health crisis that continues to rob the United States for its most valuable assets, its people. And I think all of us in this room can identify with that line. On behalf of the Substance Abuse Task Force and Treatment Task Force, I want to thank you for shifting our national conversation about addiction and recognizing for what it is, a disease. Everyone who has struggled with this disease or lost a loved one knows that it takes a toll on Americans' families. And all of us here, we know that. I want to thank all the mayors in this room for your leadership. I'm proud to say that Dr. MURTHY is a Boston-trained physician. He completed his residency at one of our many great hospitals, Brigham and Women's Hospital and Harvard Medical School. And before I hand it off to Dr. MURTHY, I'd like to thank all the members of the Substance Abuse Task Force for your great work, not just today, but a year and a half ago when we started. I remember we had a meeting, I believe it was in this hotel, and we had about 3 mayors, about 4 staff, and today we certainly have gone a lot more because mayors lead by example, and we're helping shift the culture around addiction and recovery in our cities. We need to continue fighting the stigma and surrounding addiction and move our energy towards supporting the people as they struggle with this disease. Changing that conversation on addiction and recovery and stigma will save lives in our country. I look forward to working with all of you on this issue, and it's my great honor to introduce you, Dr. MURTHY, the Surgeon General of the United States of America. Thank you.
Well, thank you so much, Mayor Walsh, for that kind introduction. And to Mayor Cornett, I want to thank you for your leadership of the conference and also for your warm welcome to be here with you today. It is a real privilege to be here with America's mayors. I was explaining to our subcommittee just a little while ago that one of the reasons I love being with mayors is that you are at the perfect place in American society to be able to listen, but also create change. You're close enough to the ground that you understand people's experiences. They know who you are. They trust in you. They know that you understand their life and what they're going through. But you're also functioning at a level where you can participate in creating change and in solving their problems. And sometimes here in D.C. can feel that we're very distant from the real experiences and challenges that Americans are facing every day, which is why I find it so important in my job to get out and to go into communities. But you know, as it's often been said that our states are the laboratories of democracy, and I really look at our cities as the Silicon Valley of our nation, because you are the place where innovation can take place and where real progress can be made and partnerships built. So it is a real privilege to be here today with all of you. I had the chance to meet with the conference last year when there was a meeting down in Miami, and Miami is actually my hometown, so my family actually got to come with me. They don't usually come with me to events, but they said, hey, let's tag along. And so they got to meet actually some of you in the room, and they had a wonderful, wonderful experience. And so I want to thank you for welcoming all of them last year. I want to explain to you a little bit about what I do, because I realize that's utterly unclear to most people. You know, someone was telling me the other day, they said, you know, every time I go out and I order a bottle of wine, I see your name on it. Like, how does that feel? And I said, well, I feel that the Surgeon General's label is ubiquitous, but an understanding of what I actually do is not. So I thought I would just tell you. So the Surgeon General has two primary roles. One is to share information with the country about health so that people can make good decisions for themselves and their families. And this is information that should be grounded in science. I say that specifically because we live in an age where there's all kinds of information out there, and a lot of it is not scientific based and can lead people to make decisions which ultimately may be harmful. I'm reminded that about 15, 20 years ago, when the internet was becoming popular, I remember an article that ran in the papers that said, after the internet becomes ubiquitous, people won't be able to lie anymore because you'll be able to fact check it just by searching on the web. I think we all know how that worked out. Not so well. So the importance of providing scientific-based information is more important now than ever before. But the second role of the Surgeon General is to oversee the operations of the United States Public Health Service Commission Corps. And I'm curious, just by show of hands, how many of you have either heard of the Commission Corps or have officers in your communities that are from the Commission Corps? So just a few hands. My guess is that many more of you actually have officers, you just may not know it. But part of the reason I want to bring up the Corps is because the Corps comprises 6,700 officers who are healthcare and public health professionals, and they are distributed in 800 locations around our country. Their job is to help advance medical care and public health. So they include doctors and nurses, pharmacists, physical therapists, public health experts and administrators. They include public health engineers, and you may not even know those existed, but they do. And they're especially important when we're dealing with water crises and other structural issues which contribute to health. We have veterinarians in our group. We have all kinds of public health professionals. And in addition to serving day to day in key medical roles around the country, they also respond to emergencies. So when we had the scare with Ebola, we actually sent hundreds of Commission Corps officers to Monrovia in West Africa to set up the Monrovia Medical Unit and care for patients with Ebola. After 9/11, we sent officers to New York to assist with the recovery efforts. After tornadoes and hurricanes, we deploy officers to assist not just with direct medical care, but with mental health care and with the rebuilding and recovery effort. So that's what the Commission Corps does. I have the great privilege of overseeing those extraordinary officers, and it is the reason why I wear this uniform. This is the uniform of the Public Health Service Commission Corps. So that's a little bit about what the office does. Mayor Walsh mentioned a report that we released in November, the report on substance use and addiction. I want to touch a bit on this report because the issue of addiction is one that is touching all of our communities. It's one that is really ravaging our entire nation. When I was trained in medical school, nobody told me that substance use disorders would be one of the most common illnesses that I saw, but it has turned out to be the case. No one really trained me extensively in how to diagnose and treat substance use disorders. That was something I ended up having to learn later. And very importantly, there's very little training given to us in how to manage pain safely and effectively. That, again, is something I had to learn later. But the lack of training in those regards is one of many factors that has contributed to some of the challenges that we have with addiction in America. You might ask the question, why did we release the Surgeon General's report on this topic? After all, what good does a compilation of papers sitting on a shelf that you need a PhD to understand really do for the country and for the world? Well, I should mention to you that when I began my tenure as Surgeon General, it was with a very specific intent around how we do our business. It was with the intent to, number one, modernize how we communicate. So we're not just communicating to folks who have a PhD, but we are generating content that is available and accessible to everyone in our community. And the other intention that I had was to not only disseminate information, but to make sure that we were increasingly going directly into communities to help ensure that that information translates into real change. Because all of us know that if information was enough, we would be eating healthy all the time and going to the gym 3 to 5 times a week. And my guess is that not all of us are doing that. So we know it takes more than just information. But in the report, which was the first ever Surgeon General's report on substance use and addiction, we focused on 3 key things: the scope of the problem, the treatments and prevention resources available, and one of the greatest obstacles that we have to addressing addiction, which is the unfortunate stigma around the problem. When it comes to the scope of the problem, most people are shocked to realize that we have as many people with substance use disorders in America as we do with diabetes. 20.8 million people in America have a substance use disorder. It may also surprise you to know that that's 1.5 times the number of people with all cancers combined. But only 1 in 10 people with substance use disorders is actually getting treatment, even though we have evidence-based treatment that works. That's a massive treatment gap that we have to close. And I would ask you to imagine for a moment if only 1 in 10 people with diabetes could get treatment. Like, how would we respond as a community? It certainly wouldn't be with complacency. It would be with action, and that's what we're called to do now. That's what we ask our community to do in this report. But the second thing that we focused on when talking about the scope of the problem was the cost of substance use disorders to America. If you tally up the healthcare expenses, the criminal justice costs, the lost economic productivity that results from addiction, it comes to $442 billion a year. That's billion with a B. And I'm sure that all of you would agree that we don't have $442 billion to just throw around. This is money that we could go toward improving our healthcare facilities, building roads, improving our schools. But it's lost as a result of our crisis with addiction. And as we focus on some of the more urgent aspects of addiction, like the opioid crisis, both illicit and legal opioids, we can't forget the old substances, like alcohol, that have been a challenge for a long time. Because alcohol, still, of that $442 billion, just under $200 billion of that is due to alcohol-related disorders alone. So scope of the problem is major, and it warrants action. But the second major point of the report was a source of hope, which is to make sure people understood that we have evidence-based treatment and prevention strategies that work. The problem is we're not implementing them, and we're often not funding them. But these not only work to save lives and reduce relapses, but they also work to save money. Every $1 we put in treatment saves $4 in healthcare costs and $7 in criminal justice system costs. We have prevention programs, community and school-based ones, which can save $64 for every $1 that's invested. It's a pretty good deal, and it's one worth investing in. And the third final point that we draw attention to in the report is this unfortunate stigma that exists around addiction. A stigma that prevents people from coming forward and getting help. Stigma that often prevents us from paying the attention and making the investment that we need to this crisis in our communities. When I travel and talk to communities about the addiction crisis, sometimes we'll have cameras that come and that want to cover the events. But very often, people who living with substance use disorders will not talk to me if there are cameras around. And they'll say, well, look, if people find out that I'm struggling with a substance use disorder, I might lose my job, my friends will ostracize me, and even my doctors might treat me differently. So why do I want to come forward? And this is compounded, in fact, by a misunderstanding that we have around medication-assisted treatment, particularly with treatment like buprenorphine and methadone. There are communities and some individuals who have come to believe that methadone and buprenorphine are just categorically bad, that we shouldn't have them as part of treatment. But that actually runs counter to the science, which tells us that when used appropriately, and that's an important piece, when used appropriately, methadone and buprenorphine can be very effective in reducing relapses, reducing overdoses, and letting people live healthy and fulfilling lives. But the misunderstanding around medication-assisted treatment prevents many communities from embracing that and leads them, in fact, to say, we don't want that kind of treatment center in our backyard. So there's a lot of work we have to do to dispel the misunderstandings around addiction, to ensure that we are building momentum so that we invest in it. But the last point I want to make about addiction is this is not a problem that will be solved solely on the federal level or even on the state level. This is a problem that demands a community-driven solution. And that's why mayors are so important. Everyone I have talked to who has come through the dark tunnel of addiction and emerged on the other side into recovery has had one common thread in their stories, one element that, had it not been there, would have made their journey impossible. And that element is compassion. It's an individual in their life who supported them, who was there for them, who never gave up on them, even though they relapsed once, twice, 5 times, 10 times, 15 times. And you can't legislate or mandate compassion. You can't require that people be kind. That is an element of our culture that has to bubble up, that has to be developed at a grassroots level. That's an element of culture that has to be demonstrated through leadership. I was excited to hear earlier today from our mayor of Anaheim about his efforts to build Anaheim into a city of kindness. recognizing that kindness is an important driver of not just good health, but many of the practices that we care about. And this is actually very important because in the battle against addiction, compassion is in fact our most powerful weapon, and we forget that at our peril, because all the treatment programs in the world, all the prevention programs in the world are not going to save us if we're not able to implement them on a foundation of compassion which has to come from our communities. You know, I want to say, just switching from addiction for a moment, that there is a connection that's important for us to recognize between addiction and emotional well-being. And I mention this because emotional well-being and addiction are both going to be key priorities of our office in 2017. We started our work on both fronts, most so on addiction. But let me explain to you why the emotional well-being is so important to me and I believe to all of us. Because when I talk to communities around the country, the one thing that has become very clear to me from day one is that there's a tremendous amount of pain in our country. And I don't mean physical pain alone. I'm actually talking about a deeper kind of pain. I'm talking about emotional pain. This emotional pain results from different things, from economic hardship, from change and displacement, from violence in communities, from discrimination. There are many sources of emotional pain that people are experiencing right now. And people often will seek to relieve their pain in different ways. Some of those ways are healthy, but some of them can be destructive to one's health. And I believe that the addiction crisis that we are facing is in part a symptom of a deeper emotional pain that we are dealing with. There are other contributors as well. We have to focus on our prescribing practices for sure. We have to get treatment into communities. We have to build in evidence-based prevention programs in our schools. But if we're honest with ourselves, many of us recognize, if we look at the people around us and in our communities, that there is also a deeper pain that is driving behavior, pain that manifests as anger, as frustration, as despair. And the truth is that addiction and many of the other illnesses we're concerned about are diseases of despair driven by deficits of hope. And so as we think about how to repair and rebuild and strengthen our communities, we must think not only about what programs we can implement for treatment, we must think not only about how to finance more research, but we have to think about how do we fill those deficits of hope? How do we reduce that despair and the emotional pain that people are experiencing? The good news is that science actually tells us that not only does your emotional well-being have a powerful impact on your health, but that there are ways to proactively improve your emotional well-being. And one of the most powerful of those is actually social connection. Social connection, just to give you a sense of how powerful it is, people who are isolated socially, they live shorter lives, they have a higher incidence of cardiovascular disease, they have a greater incidence of cognitive decline, so diminished brain function. It's been said, in fact, that severe social isolation can have as much of an impact on your lifespan as smoking. And consider that. But we talk about smoking all the time. We don't pay nearly as much attention to isolation. But it's a powerful, powerful force. And that's why as we think about how to improve emotional well-being in America, bridging those gaps of isolation is going to be incredibly important. What heartens me about that is that you don't need a PhD or a medical degree to build bridges between people. You don't need an advanced training certificate to be able to connect with someone, to express and share your compassion with them. Some of the most powerful experiences that patients tell me about are the experiences, in fact, that sometimes came from strangers, people they didn't even know but who reached out to offer their help and support and made them feel that they belong, that their life mattered, and that it was worth investing in getting better. So that is why we're going to be building a campaign in 2017 around emotional well-being, because I have come to realize, by looking at not only the science, but the experience of our fellow Americans all across our country, that emotional well-being is the root cause. It contributes to our challenges with addiction, to our challenges with violence, to our trouble with a host of chronic illnesses, and it impacts non-health factors like the educational performance of our young people and our economic productivity in the workplace. So that's why we are building an initiative around that while we continue our work on addiction. But I want to thank you for the tremendous work that each of you do every day in our communities. It's easy for me to get up here and make a speech about what needs to be done. The harder thing is to be on the ground, rolling up your sleeves and actually trying to implement those solutions. And that's what all of you are doing. That's why I have so much respect for the undertaking and the responsibilities that are on your shoulders. And I want you to know from our side that we stand ready and willing to work with you and to support you in whatever way we can. I've met some of you in visits that we've made to our communities, and we hope to do a lot more visits over the coming year. My term is a 4-year term as Surgeon General. I have 2 years done in that term, 2 years left, and I want to make the most of that time to do the most good that we can for our country. So let us know how we can be helpful to you. And if you are interested in learning more about prevention and treatment resources around substance use so that they can benefit your community, you can find resources at addiction.surgeongeneral.gov that has all of the information from our recent report. The Substance Abuse and Mental Health Services Administration, SAMHSA, one of our sister agencies that we work really closely with, also has wonderful information on their site. They also received $1 billion, that's billion with a B, in funding through the recent Cures bill that was passed, funding that is primarily going into communities. And so they have put out a funding announcement or are trying to get that money to your community so that they can fund and support addiction and recovery efforts. So I would urge you to check out their website and to apply for some of those funds as well. But lastly, we want to learn from you too. This is not just about what we can give, but it's also about what you can teach us. And some of the most important lessons that have shaped what I have done as Surgeon General have come from people that I have met on the road, including mayors and other community leaders who really understand the problems on the ground and can help those of us in Washington, D.C. understand what needs to be addressed. So thank you again so much for having me here. I understand we may have a little time for some questions and answers, and I'm very much looking forward to hearing from you and partnering with you in the year ahead. Thanks so much, everyone.
I'll ask the first question.
All right.
All right, we have some microphones around. I'll go ahead and ask the first question, but just raise your hand and we'll try to get a microphone around to you. Surgeon General Murthy, we have for years been looking for additional funding for mental illness, and it just never seems to come, never seems in the right direction, and it's a continual struggle. Now comes the idea that has bipartisan support of criminal justice reform, perhaps putting some dollars that are currently going into the criminal justice system into some of the causes of the criminal justice system, and there might be some money for a mental illness aspect of that. The problem with it is it sort of criminalizes the disease of mental illness, which is unfortunate and unfair, but at the same time, it's some dollars that might be able to help some people. So what are your views on the criminal justice system, the idea of redesigning it and trying to take the responsibility of taking care of people with mental illness through some other funding source other than just the money that goes to operate the jail?
So that's a great question, and a couple of things I'd say. Number one is that we absolutely have had a problem with criminalizing illness. We did this with addiction for years, where we had a war on drugs that became a war on the people who use drugs, and we had many people who ended up in jail instead of in treatment, which is what they really needed, treatment. And so we've got to be mindful of that and make sure that we're taking a public health approach to public health problems. Now, it's clear that a disproportionate number of people in our prison systems suffer from mental illness. And in many prisons, although certainly not all of them, we actually have Commissioned Corps officers who go and provide medical care in those prisons to try to ensure that people are actually getting good care and the care they need. But our officers aren't everywhere, and we know that this has been a struggle and a challenge. And part of the problem with the way funding has worked in the past is that it has been really siloed. So if you invest, for example, in mental health and from using healthcare dollars, and the benefits accrue to another sector, that doesn't really help you in terms of your bottom line. It just makes you, if you're in healthcare, right, you're just spending more and someone else seems to be benefiting. Now, if you're thinking globally, as mayors have to do, you quickly realize that doesn't make sense, because global problems should have global funding with fewer barriers and restrictions. And that's actually the direction I think we need to move in as we think about criminal justice system reform as well, is that we need to liberate some of this funding and not just color it as criminal justice money, but recognize that we need a larger pool to address deeper problems that have manifestations across the spectrum. And mental illness is one of them, because we know that untreated mental illness impacts people's productivity in the workplace. It impacts healthcare costs, and sometimes it can impact criminal justice system costs when people don't have the care they need. So my hope is that these discussions around the criminal justice reform effort will also lead us to a larger conversation about how to break down barriers in funding. Last point on this, though, is that this doesn't have to just wait for the federal government to work. Like, breaking down barriers in funding can happen at local and state levels as well. And in some cases, it already has. And like I was saying earlier in my remarks, some of the greatest innovation is taking place at the community level, like not necessarily at the federal level. So I say that because I believe that you can actually lead the way in helping demonstrate to states and also to the country at large how sensible, rational, aggregate funding can actually drive better health outcomes for everyone.
Okay. We have people with the microphone. Okay, if you would just give us your name and what city you're from.
Claudia Bildela Pena, City of Thousand Oaks, California, in Ventura County. Thank you so much, Doctor, for your presentation. It was eye-opening and heartfelt. My question is, Thousand Oaks is a fairly affluent community. Nonetheless, we see heroin overdoses, deaths, and especially the presence of opioids. With the introduction of opioids as well as the overprescription of opioids, in your opinion or research, do you feel that the pharmaceutical industry has a very big responsibility or role to play in this addiction epidemic in our country?
So that's a great question. I'll focus my comments in particular on opioids, since you asked about the pharmaceutical industry. If we look at the opioid crisis, we realize that, we got here in part on a path that was paved with good intentions, right? So we recognized that we were under-treating pain in some cases, and we asked doctors and nurses to be a lot more aggressive about how they were treating pain. And we did that, though, without giving them necessarily the training and support that they needed to know how to do so. And I say that, again, as a clinician who was trained without a lot of those tools and had to learn them later. So that was like one aspect of the problem. But to your point, we also at that time saw aggressive marketing of these opioid medications by pharmaceutical companies, where we now realize in retrospect the risks were certainly underplayed, and that's led to legal action, which you likely know about as well. I think what this means is that all of us, including pharmaceutical companies, need to step up and be a part of the solution, not just thinking about how we change. In the case of pharma companies, thinking about how they change how they market their drugs, where they need to certainly market them legally and responsibly. But I think it's important for them to step up and be a part of prevention and treatment efforts, especially at a time where we have only 1 in 10 people with substance use disorders getting treatment. So I believe that they have certainly played a role as a sector and need to step up and be a part of the solution. I believe that's true of other sectors as well. Clinicians, we're seeing more and more taking on the opioid epidemic. We're seeing medical schools training their students now from early on. Not everyone is doing this, but a lot of people are, a growing number. We're seeing residency programs start to do the same. We're seeing more state medical societies recognize they have to train their physicians in how to treat pain safely. This kind of change isn't easy to do, but it's only going to be possible if everyone participates. And to your point, the pharmaceutical industry needs to be one of those sectors.
Yes.
Hello, sir. Thank you for being here and making your presentation. I'm Scott Miller from San Jacinto in Southern California. And my question has to do with a new law that we just implemented in California. We just voted as a state to allow for recreational cannabis in our state. And so people on both sides of the fence on this issue, it's a very hot topic, but in regards to the fact that we do not have treatments for addictions the way that we should have them in California, but now opening the door to the fact that everyone in California can grow their own pot in their house, and opening these up to communities, and looking at the impacts with students, adults, that type of thing, where do you see the counterproductiveness, or do you see the counterproductiveness in the fact that we're looking for these treatment programs instead of jail, which makes sense, but we're creating these laws that open the doors to these potentially very negative pathways?
Well, thank you, Mayor, for that question. That's a timely one, because California is not alone in experiencing these new laws around either medical and sometimes both recreational use of marijuana. My basic thought on marijuana is I think that we have to do with marijuana what we would do with any other substance, which is to let science guide our policy on it. And the concern I have with a lot of the recent legislation that we've seen is that the policy seems way ahead of the science. I'll give you an example. When it comes to the medical use of marijuana, we have evidence that there are components of marijuana that, when isolated and purified and used for medicinal purposes in the right way, then in some cases they can be helpful for reducing symptoms. There's a drug called Marinol, for example, which is FDA approved and derived from marijuana. That is very different from saying smoking marijuana is helpful for a medical problem. Because unless we have good evidence and solid clinical trials, then how do we know what the side effects are? How do we know what the right dosage is? How long you should be on a medication? We can't really tell you any of those things. And right now we don't have that quality of evidence for marijuana when it comes to use for medical purposes. When it comes to recreational use, part of the challenge I've found as I've talked to communities about this is that many people actually don't realize that, number one, that marijuana is in fact addictive. They actually think it's not, it's pretty benign, etc. But not only is marijuana addictive, and it's addictive in a minority of people who use it, but still addictive. But it's also true that the addictive potential or the likelihood of being addicted is greater when you begin using marijuana at a young age, during adolescence. And this is consistent with other things we know around addiction, where the adolescent brain is particularly vulnerable to the development of substance use disorders. And so folks don't always necessarily understand that, the fact that marijuana is addictive and it can have adverse effects on the developing brain of adolescents. And the misunderstanding about the impact of marijuana and around the science around it is what I think unfortunately leads people to certain conclusions and in some cases certain policies around marijuana. What I do believe is that we need to invest in the science to do more research on marijuana, because the truth is that it should be science and not ideology that ultimately drives what we do with our policy. And that's why I've been happy to see that during the last several years in the Obama administration, they've taken steps to increase the quantity of research-grade marijuana so scientists can study it. They've taken steps to reduce some of the administrative barriers to doing research on marijuana. There's still more things that we need to do to make that research easier. But I believe that's the path that we need to go down. NIH is also funding a number of studies on marijuana as well, which are going to be important. I'm all up for finding a cure for the diseases that ail us wherever we can. But we got to let science guide us in that process, and I worry that that's not entirely happening on the policy realm right now.
How about one more question? Okay.
Go ahead. I'll yield to my. Thank you, sir. Growing up, I would always see my Surgeon General come across the television screen, and I learned that in that position, you're the chief spokesperson as it relates to public health matters. Does that send a message that the issue of public health has drooped, or are they going to start that program again to where people see the uniformed Surgeon General speaking to the American people?
Well, that's a great question. It's a great question. I actually grew up and had a very similar experience to you. I saw C. Everett Koop on TV a lot and in the papers. That was one of the first times I can remember paying attention, to a Surgeon General. Was back then. That was also a different time. That was a time where we had about maybe 5 or 6 channels that people watched, where most people also read a few newspapers, where there was no social media, and for people to gather their information from. Unlike then, now we have many people who don't watch TV or read the newspaper at all. They watch all their movies on Netflix, all their TV shows on Hulu, and they get all their information from Twitter, Facebook, and Snapchat. Right? That's sort of like a new age. And that's made it a really interesting challenge to think about how do you get information out, whether it's public health information or any other information, when there's been such a splintering of pathways through which people get their information. But it's a challenge we got to take on. So I'll tell you a little bit about how we've been thinking about it in our office. One of my intentions, as I told you in my remarks, was to modernize how our office communicated. So to us, what that's meant is using social channels as well. So we just disseminate a lot of information via social media, to target audiences. It's also meant using traditional media around well-recognized products like our reports on substance use and addiction, and a recent report that we did on e-cigarettes. And I mentioned that in particular because it was actually the very first meeting that I came to with a small subgroup within the U.S. Conference of Mayors, where several mayors first raised a question around e-cigarettes to me. This is early in my tenure, and they said, we were so confused about these things. What are we supposed to do? Are we supposed to include them in clean indoor air laws or not? How are we supposed to think about these things? And that was part of what motivated us and mobilized us to actually create the report that I released in December. So I want to thank all of you for that. But when it comes to those reports, we've done those with a lot of traditional media and have tried to really think about creative partnerships that we can build. With addiction, for example, are any of you familiar with the TV show Mom with Alice and Janney? So a couple of you are. You may or may not be the right demographic for it. I'm not sure. But Mom is it's a very popular show on CBS. And what's interesting about the show is the storyline is based around a family that's struggling with addiction. And it really chronicles a lot of the challenges that the family is having. What we did is we actually got together with the cast of Mom, with Alice and Janney and several others. And we actually did a PSA with them, which we aired after the show. Now, that reached people who may not be watching the nightly news, who may not be reading the newspaper, etc. And what it did is it actually resulted in a doubling, in fact, more than a doubling, of the calls to the SAMHSA helpline immediately after the PSA aired. So what we're finding is that if we really want to reach people, we have to use multiple channels, we have to use multiple messengers, and we have to use multiple messages as well. So it's a more fragmented approach to communication, but we're finding it's what we got to do in 2016 to make sure we're getting across to everyone. So thank you for the question, though.
All right. Join me in thanking the Surgeon General for his time today. Thank you. Appreciate it. And I want to thank all the mayors who participated in this historic 85th winter meeting, the largest such gathering in our 85 years. I want to thank Tom Cochran and his entire staff for all the help that they've given the mayors this week, and the sponsors who helped make the event possible. So thank you all, and those of you that can join us in Miami Beach in June, we look forward to seeing you then. So long.